Chairman Williamson. Chairman Williamson on.
Good morning.
Hey, good morning. How are you?
Doing well. How about yourself?
Doing good, doing good. And you just let us know when you're ready. It's 8:59.
All right.
Yeah, that's fine. Stuart can turn on his camera when we get to that point.
All right, I'm showing 9 o'clock. So we will go ahead and call our Care Management Committee meeting to order for April 11th, 2024. The minutes from our prior meeting, which was January 18th, were sent out. I hope everyone had a chance to review those. We focused on the healthcare workforce in the state of Georgia and heard a lot of information about efforts to grow the workforce and also for areas or parts of the state that may be a little underserved to have improved access or how to reach folks in some of these harder to serve or reach areas. So some really good reports and information there was shared. And if everyone has had an opportunity to review those, we will move to our first agenda item, which is the introduction of our new Medicaid Executive Director. And Lynette, can I turn that over to you?
Absolutely. So good morning, everyone. Before we do the introduction for Stuart, just want to confirm if we have all of our committee members present this morning. Dr. Cynthia Rucker.
I'm here.
Awesome, thank you. Roger Folsom.
I'm here as well. Good morning.
Good morning. Shane Mobley. Shane Mobley. Okay. And Robert Coles.
Here.
All right, awesome. Thanks everybody for joining this morning. So it is my pleasure to introduce to the committee our new executive director for the Medical Assistance Plans Division. For those of you who were able to attend our board meeting last month, the Commissioner Carlson did formally introduce Stuart Portman to the board, but wanted to take an opportunity to allow him to introduce himself to this committee as well. As we transition roles, and I'm sure most of you have heard by now, I am transitioning to a new position, and Stuart Portman will assume the duties and responsibilities that I held as the executive director of the Medical Assistance Plans Division. So as part of that transition, Stuart Portman will now lead these meetings. So he will be responsible for setting the agendas going forward and will present out to the committee accordingly. So I want to take a moment just to turn it over to Stuart. Stuart, you can introduce yourself to the committee, and then I am going to formally pass the baton to Stuart, and he will lead this meeting moving forward from this point on.
Perfect. Thank you, Lynette. And it is good to be with everyone. I will do a quick unmute. That way at least my face appears. It is good to be with all of you. I'm Stuart Portman. I have now been here at DCH for 2 months, and it has been a wonderful, wonderful experience and very warm and hospitable introduction to the world of Georgia Medicaid, where we are very busy. So I come from Washington, D.C., where I served as a senior health policy advisor on the U.S. Senate Committee on Finance. In that role, I was the lead policy advisor, developer of legislative text, reviewer of CMS regulations and guidance, and assisting members writ large on their policy issues on anything that related to Medicaid or the Children's Health Insurance Program. So was a part of a lot of conversations as it related to the changes, pretty much starting with the implementation of the managed care rule from about 8 years ago, and all regulations and policies and legislative attempts since then. So it has been a really rewarding and rich experience, but I wanted to learn a little more about what it meant to handle the operations of Medicaid and not just talk about policy from the federal 30,000-foot level. And so now I am here and learning from the great team and look forward to all of our interactions and our work together for the community here in Georgia.
Stuart, we look forward to working with you in your new role, and your background, I think, brings you well qualified to kind of take on these new responsibilities. And we, again, congratulate Lynette in terms of her new role and thank her for everything that she has done in the past to support our care management committee. I've enjoyed working with her personally as we've kind of gotten this committee pulled back together, and know she will continue to make an impact in her new capacity, and will effectively transition things over to Stuart. So, so with that, are we ready to move to our next item, which will be Dr. Holloway sharing information with us this morning. So Dr. Holloway, can we turn it over to you?
I'll be happy to, Chair Williamson, and good morning to the rest of the committee as well. I just wanted to spend a few minutes providing an overview with the committee of our updating of our quality strategy. We are currently operating within the quality strategy for 2023, 2021-23, and we'll provide a brief overview of our process of updating that for the 2024 to 2026 timeframe. While I'm serving as the executive champion of that, we go to the next slide, please. Dr. Gloria Beecher, who is our director of the Population Health and Quality Planning, is leading the efforts. We're certainly dependent upon subject matter experts within our department, as well as supported by our external quality review organization, Health Services Advisory Group. Next slide, please. Just to provide kind of an overview of state Medicaid agencies that utilize care management organizations for a healthcare delivery model must, be it for the managed care rules, develop a quality strategy that is written and available speaks to how we will improve the quality of healthcare for the beneficiaries that are served within those plans. It's also the expectation, be it that rule, that the plan would be updated on a minimum of every 3 years. Next slide, please. Just as a backdrop, they also give guidelines in terms of what must be included in that quality strategy, certainly the background of Medicaid within the state of Georgia, very SMART goals, specific, measurable, attainable, and in terms of relevant and time-specific goals and objectives, targets that will be set that we will be able to measure whether we achieve that as far as effectiveness. What performance improvement projects will be engaged by the plans that will drive toward those particular goals, and also how will health disparities be addressed within that time frame as well. Next slide, please. Also, guidelines are provided in regards to whether accountability systems that are in place within the state to oversee the activities of the plans, and also the opportunity for stakeholders, inclusive of this particular body, to provide feedback of the strategy plans that are being put in place. And how do we leverage the resources of the external quality review organization? As we reference, Health Service Advisory Group is our vendor that we contract with for that purpose. Next slide, please. The actual logic model that we've engaged in to actually develop the past as well as the current one with a few tweaks going forward is that we take a look at the landscape in terms of what's occurring within our populations that we serve within the state, also in regards to our resources within the department, our sister agencies, as well as external stakeholders as well. And what's the capacity of our ECRO to assist and support those endeavors? There are outputs that occur from that results in activities that are noted here, and ultimately leading to be it short-term, midterm, and long-term outcomes. Some of the short-term are more process-driven, but ultimately wanted to impact the outcomes that are more long-term or more in terms of terminal goals, such as morbidity, mortality of our beneficiaries. Next slide, please. The content, as we referenced, that will be in there certainly speaks to the purpose of the actual strategy, the background of Medicaid in Georgia, the approach to the strategy in terms of how it's developed, how we review it, how we revise it from a prioritization and a resource perspective. Next slide, please. Also, in terms of, we reference the quality structures that are in place for accountability purposes, our QAPI, our quality assessment performance improvement programs that not only the CMOs have, but at the state as well, and the governor's oversight of that. Next slide. We also will have appendices that will be attached to the slide that references the crawl walks to the strategy to regulatory, be it CMS, also in regards to the performance measurements, which extend beyond just the objectives, which we'll reference just in a little bit. Also the PI, or the performance improvement topics that will be engaged, be it by the CMOs within the time span of the quality strategy, how we track that over a period of time. Also included within the appendix of the quality strategy will be the effectiveness of the current strategy, which will be ending in this year, 2023. I think it's a note that of the 24 target goals that have been established for the 2021-2023, 7 of those target goals have been met year to date through 2022 data availability. We won't be able to close that out until the end of this quarter, excuse me, the fourth quarter of this year, just based on the timing of how measures come forward. But of the 24, 7 of those goals are met year to date. 3 of them are within range to be met, which means that 14 of the goals targets have not been met year to date. Next slide, please. So as we stated, we will be seeking input from stakeholders, inclusive of this board. We've already had an opportunity to have a conversation with the Medical Care Advisory Committee, the Quality Oversight Committee. The draft of the quality strategy will be posted to the website for access for stakeholder input. It'll be available for input to be received for over about a 12, excuse me, I certainly don't mean 12 months, but 1 month period, starting once it's posted and then the 30 days. Hopefully we're targeting mid-May. Next slide, please. Just from a high level perspective, I won't do a deep dive into the objective, but there's 7 overarching goals that are noted here and a total of 28 objectives. The goals are aligned with what we use for the visualization purposes, aligned to four pillars around quality, access, stewardship, how we use our resources, and the members' experience. But the goals are noted here as far as improving access to care, improving wellness and preventive care. Next slide, please. Improving outcomes for chronic diseases, improving maternal and newborn care. Next slide. Improving behavioral health care outcomes. And the next slide. Improving utilization of care and services, and improving the member experience. Next slide. This just speaks to the time frame from when we started the activities to update the strategy to our projected goal of submitting it to CMS in the latter part of June of this year. We are at the phase now, as I stated, for feedback from stakeholders, inclusive of your feedback, once it's posted, for you to be able to access that. We certainly desire and would expect that you provide that feedback so that we have an opportunity to review feedback for all stakeholders and incorporate the applicable information into the revisions of the strategy, and then ultimately submitting it to CMS the latter part of June. Chairwoman Williamson, that's the end of the presentation, but welcome any comments or questions at this time.
So let's open it up to our members. Are there any questions for Dr. Holloway on the updated plan, the areas of focus, kind of approach, timeline, all those things that were covered with us?
I do have one question. Good morning, everyone. Dr. Holloway. Related to the plans, will we see, or I'm assuming that each of the entities are teasing the information down to the baseline performance and targets?
What you will be able to see,
like for different performance measures? I'm sorry.
No. Thank you for your question. What you will be able to see, what's posted, you'll be able to see within the appendix, the effectiveness of the past plan. You will be able to see the performance toward targets that did indeed have a baseline. And this quality strategy that's being proposed for the 2024 to 2026 timeframe utilize that information to help construct this one, in addition to other information. So you will be able to see performance to the previous strategy, where we are year to date to those particular targets, and it'll be shown in a stoplight format. You'll be able to see it by green, yellow, and red to those particular targets. And that's all based on baseline, where we are year to date that we reference, but also appreciation, as stated, we wouldn't be able to finalize that until the end of this year, when we do have that data to close out the 2023 year.
Okay, thank you.
Did I answer your question?
You surely did, yes.
Thank you.
Thank you, Dr. Rucker. Are there any other questions from our members? A question from me, Dr. Holloway, when you look at the kind of the new go forward plan updated, could you maybe highlight or focus on, are there any particular new areas or things from the prior plan that kind of steered us to want to focus on some different areas? Anything that maybe stands out? I'm hearing that the big goals, in terms of the focus areas, the large ones are kind of in those same pillars that we might anticipate. But anything that kind of stands out as maybe kind of new areas that we want to focus on moving forward?
Sure. Thank you, Chair Williamson. One thing that we did, based on taking a look at where we were year to date to the old strategy, that strategy had an overarching 3 main goals with aims. We didn't do aims this year, but we expanded the number of goals based on how things were falling out from that particular strategy. It's still reflective of the work and the priorities. It's just now delineating out now to 7 goals versus the 3. We still have in there the maternal health and newborn outcomes that was highlighted in an instance. We've kind of pulled out the behavioral health now to make a distinct entity as a focus. Chronic illnesses is distinct, even though it was embedded in a goal last time. I think one thing that we do have an awareness from the interfacing with the CMOs and so forth over the time span is that the public health emergency certainly had an impact as it pertained to some of the outcomes, particularly around access, some of the screening and access, particularly around the adult measures. That's a focus and highlighted based on where we were landing year to date in the current strategy. So to answer your question, just kind of in summarizing, yes, we are highlighting some of the particular areas by expanding the goals that were embedded a little bit more in the old strategy.
Gotcha. All right. Appreciate that. Thank you. Any further questions for Dr. Holloway? All right. If not, then we will move. Thank you, Dr. Holloway, for sharing that with us.
Thank you.
We will move to our next topic on advancing mental health parity in Georgia, and we will hear from Maxine Elliott.
Hi, good morning, everyone. Can you hear me? Everyone able to hear?
Yes.
Okay, wonderful, thank you. Good morning, my name is Maxine Elliott. I'm the Deputy Executive Director in the Medical Assistance Plan, working under Stuart Portman's leadership, and I have a specific focus on service delivery and administration. It's a pleasure to be here this morning to have this opportunity to present on the topic of mental health parity. And the title of my presentation is Advancing Mental Health Parity in Georgia, a Comprehensive Approach. For us, this isn't just about healthcare equality. It is about fostering a healthier and more inclusive Georgia. Next slide. So just as a reminder, core to everything that we do at the Department of Health here, it's our purpose. We are committed to shaping the future of a healthy Georgia for all, by improving access and ensuring quality to strengthen the communities that we serve. Next slide. So in order to set the stage, I just wanted to share some data with you, just to take a view of the current state on the national level, and then to move to what things look like in Georgia. So nationally, as you can see on your screen, approximately 16.39% of our youth, and we're talking about between the tender ages of 12 to 17 in the US, reported suffering from at least one major depressive episode in the last year. The percentage of youth experiencing severe major depression is 11.5%. Nationally, 59.8% of youth with major depression do not receive any mental health treatment. 6.34% of youth in the US reported a substance use disorder in the past year. And among adults, 20.78% were experiencing mental illness, and 15.35% had a substance use disorder just in this past year. Next slide, please. So what's going on in Georgia? While we have data that mirrors national trends for adults, we do recognize that our children and adolescents face similar challenges. In the state of Georgia, the prevalence of adults reporting mental health and with specific focus on the children, the components of the children, again, it's very reflective of the data that I just shared with you on the national level. Specific statistics for children and adolescents in Georgia indicate these similar challenges. Georgia faces challenges in mental health care access for all ages, with a portion of adults in mental distress unable to afford a doctor's visit. And understanding these statistics is crucial. They not only highlight the breadth of mental health challenges across all age groups, but also underscore the urgency and necessity of our efforts in mental health care, advocacy, and policymaking. This data supports the importance of targeted mental health initiatives and support for these vulnerable age groups. Next slide, please. So one of my objectives this morning is to make sure that everyone on this call leaves with a good understanding. For some, it might just be a reminder, a refresh of the essence of mental health parity. At its core, mental health parity is about equality, treating mental health on the same footing as physical health in healthcare coverage. The Mental Health Parity and Addictions Equity Act of 2008 set the stage nationally, and here in Georgia, we're committed to upholding these standards. Our approach ensures that insurance plans offer balanced benefits for mental health, substance use disorders, and physical health treatments. By continuously enhancing our reporting and compliance mechanisms, we are ensuring that all Georgians receive equitable and comprehensive mental health care. And this slide just gives an overview of the concept of mental health parity, its legal background, its practical implications, and how these principles are implemented and monitored right here in the state of Georgia. Next slide. So I'd like to take a moment to focus on House Bill 1013, a landmark in Georgia's mental health care reform. This bill, enacted in 2022, marks a new era in mental health parity in our state. It's not just about equal coverage in insurance plans, it's about real changes in the availability and quality of mental health services. From expanding treatment across to enhancing law enforcement training for mental health crises and establishing incentives for future mental health professionals, HB 1013 is a comprehensive approach to improve mental health care. Crucially, it includes provisions for monitoring and reporting, ensuring that these changes are effective and that insurers are held accountable for parity compliance. This bill represents a significant step toward a more equitable and responsive mental health care system in Georgia. This slide just provides a quick overview of House Bill 1013 and highlights its objectives, its key features, and the expected impact on Georgia's mental health care system, making it a crucial part of the state's effort in ensuring mental health parity. Next slide. So let's take a look at the direct impact of HB 1013 on both healthcare providers and patients. For providers, this law is not just a mandate, but it is actually a support system offering training and resources for better mental health care delivery. It also establishes and facilitates the establishment of more mental health crisis centers, ensuring that urgent care is just a step away for those in need. Now, for our patients and beneficiaries, this translates to more accessible and timely mental health services. Importantly, the law revolutionizes how police and emergency responders engage with mental health crises, fostering a care-first, preventative approach and moving away from the sick care model. Next slide. It is essential for health plans to not only comply with mental health parity laws, but also to transparently report their compliance. This process involves regular and detailed reporting, providing critical data that guides our ongoing evaluation and improvement strategies. Health plans in Georgia are required to demonstrate how they are meeting mental health parity requirements. Regular reporting by insurers on parity compliance is mandated, ensuring ongoing oversight and transparency, and provides the state with a data-driven mechanism to assess, correct, and improve. Through this, we can ensure that mental health parity is not just a policy, but a practice, benefiting all Georgians. In order for us to start to see outcomes, we must have partnership between state entities, providers, and care management organizations. Next slide. The Department of Community Health plays a critical leadership role in this transformative journey. As the agency responsible for implementing and overseeing these laws, DCH is committed to ensuring their success. Our future initiatives aim to not only comply with these laws, but to innovate and expand mental health services in Georgia. This involves strategic workforce development and a commitment to enhancing the range and quality of services available. Next slide. EPSDT, the Early and Periodic Screening, Diagnostic and Treatment Program, is instrumental in upholding mental health parity, with a significant impact on the care of children and adolescents, including those with autism. This preventative health program ensures regular mental health screenings as a part of core pediatric care, facilitating early identification of mental health concerns. For the autism population, EPSDT is particularly vital. These screenings can lead to the early detection of autism spectrum disorders, allowing for timely intervention and access to specialized services. This early intervention is also key to enhancing outcomes and supporting the developmental needs of our children with autism. By integrating these crucial mental health assessments into routine health checks, EPSDT not only embodies our dedication to mental health parity, but also significantly contributes to the early and effective support of one of our most vulnerable population, and that is children with autism. Next slide. So, with that said, what progress have we made in Georgia concerning mental health care? Our approach to date has been multifaceted, involving collaboration across various government agencies and CMOs. Together, we are working tirelessly to expand access to mental health services, improve care quality, and ensure policy compliance across the state. Significant steps have been taken to establish more mental health resources, including crisis centers and telehealth services. We are also focusing on the future of mental health care by investing in training and workforce development, ensuring that we have a skilled workforce, adequate supply of credentialed professionals ready to meet our community's needs. Next slide. So ensuring compliance with mental health parity laws and enhancing data-driven strategies have been crucial in our efforts. We're not just implementing policies, we're continuously monitoring and adapting them to ensure they effectively meet our citizens' ever-changing needs. So policy implementation and compliance, it follows HB 1013. There has been a concerted effort to implement policies ensuring mental health parity, and the data collection and analysis and reporting, again, an enhanced focus on data collection to monitor the effectiveness of mental health services and identify areas for improvement. Central to all the strides we have made in Georgia regarding mental health care is the DCH Mental Health Parity website. Next slide. An essential resource for understanding and enforcing mental health parity laws. The Georgia Department of Community Health provides comprehensive information on mental health parity through this website. This platform educates on federal and state parity laws, including Georgia's mental health parity law, HB 1013, ensuring health plans cover mental health and substance use disorders equitably. A significant milestone is also the establishment of our mental health complaint portal. It reflects our commitment to ensuring that individuals' concerns about parity in Medicaid and other plans are identified, heard, and addressed. This tool allows individuals to submit complaints regarding parity concerns in Medicaid, Peach Care for Kids, or the State Health Benefit Plan, ensuring adherence to mental health parity regulations. Our collaborative work with CMOs like Amerigroup, CareSource, and Peach State Health Plan has been crucial in expanding mental health services. Next slide, please. So again, this topic of compliance with mental health parity laws and enhancing data-driven strategies, this has been crucial in our efforts. The collaboration between DCH, government agencies and CMOs, coupled with the robust reporting and compliance system, has strengthened the mental health care framework in Georgia, enhancing access, equity, quality, and mental health services. Capacity building is at the forefront of all that we are doing. The current procurement has behavioral health as one of the three main pillars in which what will be the new CMO contracts. Internally, we are building our capacity to monitor outcomes, develop incentives, and enhance quality standards with payers. For example, not so long ago, transportation was not a covered service for Peach Care for Kids beneficiaries. As part of our efforts and commitment to achieving mental health parity for all Georgians, we worked to develop policy, implement the policy, and we are now providing a service covered under CHIP program, non-emergency and exceptional transportation. we recognized and responded to the critical driver that transportation plays in ensuring timely access to care for our CHIP members. Next slide. Well, with every new implementation and with every change, there's always challenges. So let's take a quick look at the challenges we've encountered and our commitment to overcoming them in our journey towards full mental health parity in Georgia. Implementing parity has not been without hurdles. Ensuring equitable coverage and access to mental health services requires constant vigilance and adaptation. Georgia has faced significant challenges in fully implementing mental health parity. This includes ensuring that mental health services are covered equitably in health plans and that beneficiaries receive the care they need without undue limitations. Crisis response has been a challenge, and our commitment to revolutionizing mental health crisis response is evident through our collaboration with community stakeholders and sister agencies like DBHDD. This joint effort is focused on a comprehensive analysis of the existing crisis response systems, aiming to pinpoint and address specific treatment needs and to develop them further. We've engaged in developing peer support specialists. We are taking on trauma-informed interventions, integrating this trauma-informed modalities into our interventions, treatment and care approaches, and ensuring that they are tailored to meet individual needs and experiences. We're looking at rural versus urban sensitivities, linguistic and cultural sensitivities. And we're also establishing comprehensive training programs. Next slide, please. In conclusion, let's reflect on where we stand. The first year, now remember, this is 1 year of a 5-year plan. So this first year has been a testament to our dedication and hard work towards establishing mental health parity in Georgia. We've started strong, but this is just the beginning. The next 4 years of our implementation plan are crucial, and there's so much more to be done. Our commitment goes beyond meeting legislative requirements. It's about genuinely enhancing the lives of those we serve. We understand that the road ahead is challenging, will be challenging, but it's a journey we are prepared to take, driven by our dedication to the people of Georgia. We call on each one of you, our valued stakeholders, to continue this journey with us. Your insights, your expertise, services, and partnership are vital in shaping a future where mental health care is accessible, equitable, and effective for everyone. And remember, this is just year 1 of 5. Looking ahead, we are inspired by the possibilities of what we can achieve together. Our vision for the future is clear: a mental health system that truly embodies parity, where every Georgian, regardless of their circumstances, has access to the care they need. Together, let's continue to work tirelessly towards a healthier, more inclusive Georgia. Thank you so much for your time.
Thank you for that report, Deputy Executive Director Elliott. Very informative, lots of good information there. Can we pause here and see if we have any questions or comments from our board members, please?
Mr. Chairman, this is Roger Folsom. Those were actually 2 very good, concise reports, but gave us tremendous amount of data and very effective reports. So I appreciate both.
Thank you, Roger. Any other comments or questions from our board members for Deputy Executive Director Elliott?
I do want to share very strong presentation, and I actually, when I first got the information, I guess a week ago, went online and went into the portal and all of that and watched the video. I think, you know, we've done a really good job of explaining what it is and presenting it. So very good, very good.
Appreciate that. I do have one question for you, Ms. Elliott. You mentioned as part of the implementation collection of data from the CMOs on the overall effort related to parity and the implementation. Are you able to share any more information on the types of data? What sort of metrics or things are they reporting on?
So my first comment. Oh, okay, sorry. So my first comment in response to that question is all of the compliance reports from the CMOs are available again on our website. It provides a clear and very concise overview of all of the different components of parity that they are held accountable for. I'm going to let Lynette Rode take a deeper dive to answer your question, but I didn't actually point that out in this particular presentation, but those reports are actually available for your review on our website as well. So Lynette, I'm going to ask you if you could take a deeper dive.
Yeah, I'll jump in on that just to give a little more context. So we're looking at everything, Chairman Williamson, from the denial of claims, prior authorization requirements, whether or not there are any limitations, aggregate lifetime dollar limits, and we're comparing physical health services to any type of mental health services. And I am pleased to state that for the past few years that we've been looking at mental health parity, and preparing those reports, we've not identified any substantive issues. And so the CMOs are doing a really good job in this area. I will also add that, we're, as it relates to mental health parity, are not only looking at Medicaid and CHIP, but also the state health benefit plans as well as a part of that effort. And so perhaps maybe that's something we can bring for a future session is just some insight in terms of how things are looking on the SHBP side of the house. But again, overall, we are doing pretty good in this area. But yes, they look at claims data, they look at denials, they look at prior authorizations, they look at the services that are utilized, and any type of limitations or barriers, again, to ensure that we're equitably treating members in both areas of physical health and mental health. That's right, and the reimbursement rate. So, of course, that is somewhat dependent upon appropriations. So we try to do our best to ensure that there are no barriers there as well. There were a number of rate studies that were done previously. Deputy Elliott addressed that. And so as a result of those rate studies, there have been some increases. So we'll continue to review that ongoing and looking forward. But just want to remind the committee that some of that, as it relates to rates, is contingent upon appropriations from the General Assembly. So I'll pause to see if there are any other questions. Or Deputy Elliott, if there's anything else you wanted to add.
No, I think that's pretty much it, but I do want to affirm that in our day-to-day operations within service delivery and administration with the CMOs and with the different business units, mental health parity is a constant agenda item in our conversations, making sure that we're looking at innovative approaches to ensure that we are bridging the gaps that we're identifying and, trying to work with community stakeholders to make sure that we're not just putting these new approaches in place and methods in place, but we're also evaluating the effectiveness to ensure that what we're doing is actually helping us to meet those parity goals.
Well, thank you. That's very helpful, and as you said, more information on the website. But that type of data makes a lot of sense in terms of the goals that we are trying to achieve. So I think we've gathered all of the questions from our members on our presentations this morning. So I will move to ask if we have any items of new business. Well, on behalf of the committee, we want to thank Dr. Holloway, Deputy Elliott, for these presentations this morning, and great to meet you, Stuart, and welcome you into your new role. And again, thank Lynette for all of her support in the past for this committee. Great reports, a lot of information that was shared with us. And with that, we will adjourn. Thank you.
Thank you.
Thank you.